Well, of course, the Omicron variant is top of mind for a lot of families planning those holiday gatherings.
That's right. And joining us now is Dr. Suman Radhakrishna, the Director of Infectious Diseases at Dignity Health California Hospital. Doctor, thank you so much for being with us this evening.
Thank you for having me.
Well, now the Biden administration is trying to expand the availability of rapid at-home tests for COVID-19. So, do you recommend that people take those tests before they gather for the holidays? What about a PCR test, too? Those are two questions.
Two questions, yes. To start with, one side is get vaccinated. The second is if you're going somewhere, and this is especially important for the asymptomatic individuals, it would be a good idea to get yourself tested. Even if that test, that rapid test kit test tells you that it's negative, it is not 100% because it's not as sensitive as a PCR test is. But if the rapid test is positive, you are more likely to transmit the virus than if you just had a PCR that was positive and the rapid was negative. So bottom line, wear a mask. If you're symptomatic, it doesn't matter what the test shows, quarantine yourself. And if you're asymptomatic and you want to go to a gathering, if you have the test, please go ahead and test yourself.
Well, doctor, if people do attend holiday gatherings, should they take any extra precautions after, including quarantining?
Yes, everybody should take those extra precautions because you may have been exposed to an asymptomatic individual who may have given it to you. So a regular temperature check, if you have these test kits, test yourself and wear that mask and avoid going to other gatherings. And if you absolutely have to go to work, like, I work in a hospital, I will be wearing a mask all day.
All right. Well, doctor, let's do this. If you're traveling by airplane to see loved ones, do you need to take any special COVID precautions once you land at your destination?
If you are going to see, let's say, an elderly grandparent or somebody who's immunocompromised, it may be a good idea to shelter somewhere else for the first 3 to 5 days. Get yourself tested, make sure it's negative before you go in if you have the luxury of time. If you don't have the luxury of time, wear the mask. Try to stay outdoors, especially in Southern California. You can do that, but not in the colder parts of the country. And whenever possible, if you have to take your mask out, eat outside or stay in your group instead of, sitting around a table.
Doctor, it appears 2 COVID pills are on the brink of FDA authorization right now. How would those pills change the equation for doctors treating COVID?
They will really help us out because if COVID is diagnosed really early within 48 to 72 hours of onset of symptoms, then this can reduce the severity of the illness and completely prevent hospitalization, at least based on the data that we are seeing so far.
All right. Well, Dr. Suman Radhakrishna, we want to thank you for being with us once again this evening, and we're wishing you the happiest of holidays.
Happy holidays to all of you, and thank you.
Thank you so much.